Hey there, this is Dr. Evan Osar, founder of Fitness Education Seminars and developer of the Integrative Movement Systems. Welcome to this edition of Fitness Insider, part 2 of helping your clients solve their chronic neck problems. Recall in part 1, we talked about one of the most important things that you can do as a fitness professional to help your clients with chronic neck tension is get them to breathe properly and get them to be able to breathe from a three-dimensional place versus a neck and upper apical type of breathing strategy. So we want them to be able to get that rib cage to come back down while still being long and creating space through the ribs. So the neck muscles like the scalenes, the pectoralis minor, all those muscles that tend to pull us forward aren't so dominant in the role of respiration. So they become accessory muscles, not the dominant muscles or the primary muscles of respiration. In this video, we're going to talk about the second most important thing you can do with your clients to help with chronic neck problems. Now we know the forward neck is a huge problem, forward head and forward neck position. But what happens with the forward head position, and the skeleton won't move exactly the way I need it to, but just so you get the idea, is when the head goes forward like this, we get extension through the neck. So as the head goes forward, we get extension through the mid-cervical spine. But what's happening at the lower cervical spine is we're actually creating flexion. So we get extension through the upper to mid-cervical spine, and we generally we'll get flexion through the lower cervical spine. And that's why right around C5, C6 is where the most amount of disc herniations happen, because you're getting that flexion at the lower cervical spine. Now, a common exercise that a lot of therapists and chiropractors and manual therapists will give their client is to do neck retractions. So if your head's forward, then they'll do neck retractions to drive the neck back into what looks like a better position. But what's happening is it's not changing the neck position. It looks better, but it's not physically changing the neck curvature and restoring the nice lordosis that we should have in the cervical spine. So I'll show you the two variations. One, that is how traditionally this neck retraction is taught, and then how we use it in the integrative movement system. So the first way neck retractions are taught is if the head is forward, you just do this, and you just jam the neck back. And if you put your hands on your neck as you do that, so lightly palpate your neck, and then just glide your head back, and you'll feel increased tension in your scalene muscles. We don't want to have increased tension as we're changing neck position. The other thing we'll notice during this position, this chin retraction position, is now feel your cervical spine. So put your head forward, feel your cervical spine, and now go back. And what you'll feel is your neck is just sliding back into your fingers. It's not actually elongating, and it's not restoring the natural curve. You're actually just creating, from this forward head position, you're just creating more neck flexion. So again, this is not helping your clients change chronic neck tension. And in fact, it looks better, but it's not actually creating better alignment and biomechanics of the neck. So here's what we want to do. So we talk a lot about, if you watch our videos, you've seen us talk about the long neck position. Here's what we want to create. We want to create a long neck where we have length through the back of the neck. The chin comes down gently, so the eyes stay forward with the horizon. There isn't excessive neck tension in this position, and there's length that direction, so we can start to restore that natural curve. So we're going to borrow some concepts from being able to activate those deep neck flexors, so the longest colli, the longest capitis, as well as the multifidi, to help us create that length and also at the same time create proper stabilization. So rather than doing this jamming the neck, here's what I want you to start to think about with your clients, and start to use these cues and these concepts with your clients. So first thing I want them to do is I want them to get the rib cage in the right position, because if the rib cage is not in the right position, the head and neck will not assume the right position either. So get the rib cage stacked over top the pelvis. Next, think about a string from the back of the occiput. So from back here, I want them to think about being long towards the ceiling. So as the back of the head goes up, the chin comes down gently. Don't force it, don't jam it, let it come down gently. The front of the neck should be soft and remain soft the entire time. And what I'm going to do is I'm going to do a real small chin nod. So the back of my head goes up, my chin comes down with very little change in my neck position. This starts to activate the deep neck flexors and the multifidi. So I almost think of a Q coming through the front of my neck, through the back of my neck, And it's a real small motion. I want to be able to move the head, elongate the neck without over gripping from the anterior neck. So I do 3 to 5 repetitions and then relax. And I keep thinking about being long. So I keep that cue of being long through my neck, creating a line through the front of my neck, all the way back to the back of my neck. So just cue a line or a connection from the front of the neck to the back of the neck. Keep the front of the neck muscles soft, so SCM and scalene stay soft. Small chin nod, get long. 3 to 5 repetitions. And don't force the movement. And this is the position then of your neutral posture for your head and neck, as well as where you want to start to lift from. So again, we want to restore a more natural curvature, activate those deep muscles, the longus colli, longus capitis, and multifidi, to help create and maintain the nice long spine position, to start to retain or restore the cervical lordosis, so our head and neck are in a more optimal position, and our rib cage is positioned and aligned optimally below it. That starts to restore optimal function and reduces a lot of the chronic tension from holding the head and or trying to do chin retractions, which is just overactivating those superficial muscles. So that's your key number 2. So breathe, get yourself aligned right, and start to use those deep muscles to start to restore the natural alignment and position of the cervical spine. In the next video, we're going to go into the 3rd key on how do we start to incorporate these concepts with our exercises, because again, that's our 3rd key to restoring restoring function if your clients have chronic neck problems. Hope you found this video useful, and we'll see you next time in Fitness Insider in part 3. Take care.